Good evening. My name is Chinasa Onyeje, DNP student from Brandman University. My video project is about patient and public education to halt the progression of antibiotic resistance bacteria infections. What problem will the innovation project solve? What is the real problem? Antibiotic overuse, misuse, and overprescribing are a significant problem in the USA and globally. Overuse has resulted in antibiotic-resistant infections. Many of our antibiotics are no longer effective. Providers' prescription pattern and the public's assumption and expectations regarding antibiotics when seeking medical care are blamed for this. Patients and the public lack of understanding of differences between viral and bacterial pathogens and when antibiotics are needed are reasons for the demand for antibiotics. Age group most affected are 18 to 65 years. If the problems were solved, if the problems of overuse, overprescribing, and bacterial resistance were solved, there would be decreased rate of bacterial resistance infections, less demand for antibiotics by patients, improvement in prescribers' antibiotic prescription pattern, and an overall reduction in healthcare costs. What is known about the problem? There is so much information out there on this problem, yet no solution have been found, or solutions that have fully worked have not been found. Statistics about health, social, ethical, and financial costs of the problem is enormous. Davis et al. 2017 stated that infectious disease is ranked number 4 in the United States and is now the second leading cause of death worldwide. CDC 2014 reported that 2 million people in the USA develop antibiotic-resistant infections every year, and the death toll is up to 23,000 annually. Also, 266.1 million prescriptions of antibiotics were dispensed to U.S. outpatients in the community pharmacies, which translates to 5 antibiotics prescription for every 6 persons yearly, with up to 30% of those antibiotics deemed unnecessary. Harvard et al. 2018 found that among 14,987 outpatient participants enrolled in a study during influenza season, 41% had diagnoses that did not require antibiotics, but they received antibiotics. 29% had confirmed influenza through testing. They also received antibiotics. Among patients prescribed antibiotics, 38% had sore throat but tested negative for strep A, and those who had sinus symptoms for 3 days or less also received antibiotics prescriptions. Cost. The cost is enormous. Mike Chalidis, Fine, Lin, Linda, Norwalk et al. 2016 stated that antibiotic-resistant bacteria increased the cost of hospitalization to about $41 billion in 2013 alone, with 35% of that cost associated directly to antimicrobial resistance. Martins and Demian, 2017, also reported that methicillin-resistant Staphylococcus aureus, MRSA, kills 19,000 people and results in 360,000 hospitalization each year. A $3 to $4 billion in healthcare costs in USA. TB cases. TB causes about 2.6 million deaths globally due to drug-resistant TB strains. Some solutions have been tried, and those include guidelines to educate and guide the medical providers on antibiotic stewardship, proper hand washing. Reasons these things failed is because there have not been a targeted effort towards the patients and the public. Guideline information are not at providers' fingertips. Every medical provider probably owns a smartphone, so innovative tool that utilizes the smartphone would work better for ease of use and incorporate regional resistive pathogens in real time. This brings me to question number 3. With whom did you collaborate when working on your proposal? I collaborated with 3 individuals. I collaborated with 3 individuals based on different roles and profession. I collaborated with a DNP prepared family and a psychiatric nurse practitioner with 10 years of experience in integrated health services to adult patients. Medical doctor with over 17 years of experience serving the inner city adult patient population from 18 years and older. A patient who also happened to be my son, a computer engineer for 4 years with experience in building innovative apps. The interdisciplinary approach that I used yielded insightful contributions from these 3 individuals. Their recurring theme was user experience, and they also came up with unique ideas to strengthen and maximize the effectiveness of my innovative proposal. Their collaborative contributions were to integrate user experience within the app, to include supportive interventional health promotion protocols, to add a built-in mechanism that shortens use duration to address potential addiction and effect on productivity. The aim of my innovative proposal is to halt the progression of antibiotic resistance or eradicate it through mobile app game by educating the patients, the public, and the medical providers. What mobile app did you propose to use to solve the problem? I chose Superbugs, the game app, and the platform it uses is Android or iPhone. This mobile app is designed to educate patients, medical providers, and the public through solving real-time puzzles that teaches real-world problems of bacterial resistance and their roles in reducing the threat. The app is fun, endless, and multi-levels with more education as a reward for each step completed. The user learns that unnecessary use of antibiotics speeds up the process of bacterial resistance and would lead to a point in time when none of our antibiotics would work even for a small cut. The user also learns in simple layman's terms how bacterial resistance is spread by reproducing and passing on resistive genes to other bacteria they come into contact with, and the need for preventative measures such as hand washing, vaccination of more children, and promoting awareness that antibiotics cannot cure most colds, sore throat, or cough. Why is your proposed solution innovative? My proposed solution is innovative because it is a new idea and easy to use. This innovative game app can easily be incorporated into a typical after-visit summary to promote patient awareness of the real dangers of antibiotic overuse, misuse, and its association to resistant bacteria. It is easily accessible for patients and the public, so self-educate and understand reasons antibiotics are not needed for non-bacterial illness. It empowers the patients and the public to make well-informed decisions. It serves as evidence-based backup for the provider to use in teaching the patient. It can translate into patients and public behavioral change with regards to the demand for antibiotics and expectations. If adopted widely, it could expand to tablets, desktops, computers, and other electronics means to accommodate different choices of access. Superbugs, the game app, won the International Serious Play Award in 2016. This is the end of my presentation. I thank you for listening. You have a great day.